Namaste. My name is Dr. Jankana Butch and I am Medical Superintendent, Senior Physician at AyurVAID Hospital's Domlur. I am here today to narrate a case of our patient, Mr. Anirban Sarkar, 35 years old. He is getting discharged at the end of 18 days of his classical Ayurveda panchakarma treatments at AyurVAID Hospital's Domlur. Mr. Anirban came here on 27th January with the complaints of recurrent mouth ulcers past 3 years, low back pain radiating to his right leg past 3 years, incomplete evacuation of bowels, shortness of breath with chest discomfort, general tiredness, occasional shoulder pain. He complains of premature graying of hair and has been having smoking addiction past 15 years. So at the end of his classical Ayurveda treatments, today we have Anirban here with me and with some remarkable outcomes in many of his complaints and diagnoses. So how do you feel, Anirban? What is your feedback and what would you like to share with us?
Feedback wise, treatment wise, this was an amazing experience I had. My main complaint was, of course, my smoking habit and everything that you read, chest discomfort, any food, especially little rich food or little spicy food I used to have. I used to have this gas problem. My motion was not clear. So after this treatment, first I will speak about my smoking habit. So I am amazed myself because when I came in, of course I had a mindset that I have to get out of the smoking, but again I was not very sure that whether I will be able to do it or not. I have tried a couple of times before, so I was not very sure that I was like, okay, I will give my 100%. Let's see what happens. So for the first 4 or 5 days, honestly, it has been very tough. I did control. I literally had to control. But after 5 days, there was a situation. I did actually go out of the hospital, to have one piece of smoke. But strangely, when of the smoke, I don't know what happened that day, but I had a nausea feeling, and that step that I took back from there. At this point today, even if I see anyone smoking in front of me, I have a very uncomfortable feeling. So yes, so I would really like to thank you for that, and I would love to keep it that way. I would want to keep it that way, keep out of nicotine always. So that is one thing. And another is, of course, my gas problem, my body pain. Body pain, I will say, when I used to go to sleep at night, I didn't used to get sleep at least for 1 hour because of radiating pain at the bottom of my. So those have completely, almost 99%, I will say, it has subsided. I don't feel it anymore. Gas problem, not at all. I don't feel it anymore. And moreover, I do feel energetic. I feel healthy, and I have that motivation, to follow this healthy life, to keep on this healthy life. So yes, I think this is what I have always wanted.
Yes, that's great. And Anirban, I remember when we met for the first time for the consultation, and you did mention about the role of your work, lifestyle choices that you make while eating, your work hours, and you coming from a core IT background. How would you see yourself that how are your own health habits, food choices that made you to come at this point of your health concerns when you came in at AyurVAID, and that now you go with a complete good health? What would you like to advise to young IT crowd? One, so I have 2-3 parts in this question. How do you rate your own diet, lifestyle contributing to your health concerns? Second, youngsters, especially like you, resorting for quick fix to an allopathy outset or allopathy way of managing things, of popping pills or doing a symptom alleviation, versus that you chose to come to AyurVAID for Ayurveda treatments. It did take time. You had to spend 18 days of treatment to go through the entire change in diet, lifestyle. but you go completely refreshed and with a new health, which as you can feel. So, what would you like to share as a key point to young crowd like you who have been suffering, and what would be your recommendation for them, Anirban?
Doctor, I would like to contradict one statement here. I don't think it's not something like, which I have been following for 1 year or 2 years. It is from my 20s. I am 35 today. So, the last 15 years, I have been contributing to this unhealthy lifestyle. So, not only young crowds, I think any person who works in IT, not everyone, of course, but most of them, we have to sit and work. So that's our first pain point. 9 hours, 10 hours, 12 hours, we are sitting and working in front of a computer. So pain is something like, which I think every people I know have this problem with pain. Second, it's a very high intense job, and this high intense and the kind of surroundings, people are attracted like, to release their tension by habit of smoking, right? Odd hours of working, excess hours of working, we don't have like, time to eat properly. When I say eat properly, it's not what we eat, but what time. We sometimes like, at even at midnight, 12 o'clock, someone will like, at least for me, I will order a burger or a pizza. Yes. Having it, then within an hour I will go to sleep. So this has been my lifestyle for the last 15 years. So along with the treatment, what I have learned here is the timing, like, why eating food at a particular time is important. This is something which I was not aware of all these years, and this has greatly helped me. Now, in today's date, at morning 8 a.m. I need my breakfast, afternoon 1 p.m. I need my lunch, evening some snack, and by 7:38 I need my dinner. That has been my practice. So this habit, I think, has contributed largely like, to a better health. Now coming to your questions of what I would like to advise young professionals is that I think what I understand from Rajiv sir and from you as well, that our body actually has the capacity to digest everything that is edible. Is just the time, like, what time we eat, like, how what time we eat, and like, that routine that we need to
Has to be
follow
maintained.
actually contributes, like, can contribute to a better health. So that is what I would want to say, that eat your food timely. It doesn't matter what you eat, but eat your food timely.
Yes.
That's very
So
important.
those are the key points that you have learned, and Ayurveda has always been an advocate of good, healthy diet, lifestyle, eating as per seasons, following the routine and doing things on time. That of course is one of the very important tool along with side Ayurveda medications and panchakarma therapies. So Anirban, how was your process coming to Ayurveda? I understand you also benefited by insurance, which is backed at AyurVAID Hospital. So, how was the process? Was it easy for you? What were the challenges? Would you like to share something?
Insurance, I think most of the people are not aware that insurance does cover, like, Ayurveda is actually covered by insurance, because all my friends and my colleagues that I spoke to, I think more than 90% of them has no idea that insurance is actually covered. Like, Ayurveda is actually covered by insurance. So yes, and as far as the process is concerned, this is the first time, to be honest, I've actually consulted doctor, because previously, if I had, say for example, gas problem, I used to take something. If I had fever, I used to take Dolo. If I have to consult a doctor, I will take the medicine, maybe not complete the course, because I was young that time, my body used to take it. But before I came here, I think my cholesterol was high, I was pre-diabetic, right? So that was, I think, a turning point for me when I saw my reports, when I saw my health. And before coming here, honestly, it's not that my first option was obviously allopathy, like, the normal conventional medicine. But for problems of me, which I think most of the professional has, who is not diabetic yet, but who is pre-diabetic. So allopathy actually doesn't have any cure for that. So if you have diabetic, like, you can take insulin and control your diabetes. But before you are, if you are pre-diabetic, there is nothing allopathy can do about it, right? Pain management also, if you are having pain, there are, like, processes which can relieve you, but again, that is I have done it for my back pain. It was back in 2018. I had severely affected my lower back. So ultimately, it was Ayurveda, which cured me and kept me proper for 3 years. After 3 years, again I started having this problem, and that's when again, which cured me and kept me proper for 3 years. After 3 years, again I started having this problem, and that's when again I went to allopathy first, but that did not help. Again, the benefit I got was from Ayurveda. So, yes.
That's great to know, Anirban. So, I have one key point to share with all of you who are listening out to me here as a physician treating Anirban and many like Anirban. The whole population, young population, is going towards the crisis and burden of metabolic syndrome. One thing leading to another, pre-diabetes, dyslipidemia, hypertension, leading to range of medical conditions. And instead of going towards polypharmacy, classical Ayurveda has got a solution, has got a precise solution to take care of its root and treat you from all of these and preventing the complications of each one of that. So Anirban, thank you so much for joining with us today.
Thank you.
Thank you and all very best wishes.
Thank you.